Let me guess, your veterinarian or maybe a friend told you that your dog needs to go on Prozac, but you're freaking out because you think that that might turn your dog into a zombie. It's not. Prozac is good for your dog if he needs it. And what's good for your dog is good for you. I'm Dr. Orion, a veterinarian and a veterinary behavior residency graduate. A part of my job is to diagnose and find the best treatment for different animals, like dogs and cats, but also other species. The full behavior treatment has a part called behavior modification, which is kind of like dog training. The second part is environmental management, which is basically finding a way to get the world to fit your dog. And that means things around the house, things in the street, schedules, and even your behavior towards the dog. And the third and last part, and this part is actually only when needed, is using psychoactive medications. Prozac, or its generic name fluoxetine, is a very common medication used in dogs, cats, and actually many other species because it is very safe and there's a lot of experience and knowledge using this medication. Even more, the FDA approved a specific fluoxetine version called Reconcile for the use in dogs with separation anxiety. But we use fluoxetine, Prozac, Reconcile, or any other brand name, not only in dogs with separation anxiety, but actually in a lot of species with many different behavior issues. Prozac is an anti-anxiety medication from the selective serotonin reuptake inhibitors, SSRIs. But although it's a SSRI for anxiety, we use it for aggression as well, especially if the aggression has an underlying cause by anxiety. It takes about 4 to 6 weeks before you will actually see any clinical effects. So first, don't expect an overnight improvement with your dog. And second, don't be discouraged if it doesn't happen that fast. Many times, dose adjustments will be needed. Also, not all dogs were created the same. That means that the fact that fluoxetine works for many other dogs doesn't necessarily mean that it will work for your dog. But we have many other options that we can use, so don't worry. The common side effects of Prozac in dogs are sedation and gastrointestinal upset. These side effects usually go away after 2 weeks, but of course, if you see anything, please let your veterinarian know. There are also a few other uncommon side effects, for example, increase in anxiety, but because they're uncommon, I actually don't want to dive into that and freak you out. So again, if you see anything that's not normal, let your veterinarian know and see what the next step should be. It is recommended to have blood work before you actually start using the fluoxetine, and then you can use it for a very long time. Very, very long time. How long? Even a lifetime, if it's needed. But just to make sure that everything remains well, you should have your dog get blood work at least once a year. Some dogs may be weaned off the Prozac after some time. This process should be done in a very gradual way. If your dog shows signs of rebound of the anxiety or whatever behavior problem happened, he will probably need to be on the fluoxetine again at the original effective dose. Now this is important. Don't feel ashamed and don't feel embarrassed that your dog is on fluoxetine, that your dog needs this extra help. If he needs it, it's just like a dog with a heart condition that needs a heart medication. Exactly like people who need anti-anxiety medication. If you'd like to know more about different kinds of anti-anxiety medications, please write below in the comments and I will make more videos exactly like this. Or even better, I would greatly appreciate it if you could like the video and subscribe to the channel. The more you do, the more YouTube will show this video and other videos from the channel to other people interested in the topic. And maybe someone will also adopt this poor velociraptor. By the way, does your dog eat cat poop? I have a video just for you. Check it out.